Hey there, I'm Dr. Aimee Duffy. I am the founder and medical director of Carolina Integrative Medicine and Clemson IV Bar and Aesthetics in Clemson, South Carolina. And if you're watching this, you have interest or received an email about our weight loss options. And I want to talk today and just give you a little bit more information about all the different things that are out there and the weight loss strategies that we have combined together to help you get the most success in hitting those goals, because it's not just about how you feel. I mean, it is about how you look, how you fit into those clothes that are in your closet, or you want to go shopping for new clothes. It's springtime coming up, and we want to make sure that we're fitting into, maybe bikini season, that sort of stuff. So everybody has what their goals are, but also it's about how healthy you are. And we know that having optimal health also lies with having optimal weight. So we want to make sure that we're not just band-aiding it. We're not doing a quick fix, lose 20 pounds and gain it all back later. We want to make sure that we're providing the strategy that's going to work best for you. So why does this happen? And I see this all the time. People are frustrated with their weight because either they're just trying to do calories in, calories out, and that doesn't always work anymore. It's not about counting your calories. It's not about, exercising more. And if I walk 15 more minutes, or if I walk 30 minutes, or I get on that treadmill and I pound it out, then I should see weight loss happen. Our bodies don't work that way. And even though, you may want to count something, I would be more interested in you counting carbohydrates than counting calories. So, it's not about reducing your calorie intake. That puts you into starvation mode. It just sets you up for failure because you're constantly having to think about it all the time, and that's frustrating. And so I see kind of weight gain in two different categories. I see it as, I know exactly what to do, but I'm just too tired to do it. I know that I should be eating more, healthy fats and healthy proteins and more vegetables. And I know I should be getting out there and exercising. I should set my alarm and get up early in the morning, or I should try to work out when I get home, but I am just too darn tired. I don't want to think about it. The easiest thing to do is the drive-through on the way home, right? Or fix a pizza, pop it in the oven. We're high stress, we're not getting enough good quality sleep, and maybe we have some, hormonal imbalances with thyroid or adrenal that's making us tired, and that just doesn't let us do the things we know that we should be doing to get the weight off. And then the other frustration is that I'm doing everything I know. I've been to the gym every day for 6 weeks. I've eaten nothing but chicken and broccoli, and I gained 2 pounds, where all of my friends or my husband lost weight just by simply making us an easy adjustment. So there must be something wrong with my body, right? I must have a slow metabolism. Are my hormones out of balance? Do I have thyroid issue? What's going on there? We can see a lot of insulin resistance. We see leaky gut and inflammation that causes a lot of bloating, which makes us feel like we're fat, but it's really just air or water retention. And then also, is our liver not working well? So it's really important for us to meet with you and understand where you are in this process, because it helps us guide you into what's the best weight loss strategy for you. And ultimately, what most of our patients end up doing is working with us through a full comprehensive wellness program that addresses the gut, detoxification, nutrition, hormonal imbalances, stress management, mindset, and a support system. And that's really the best way to get the ultimate result from getting your health back on board. But sometimes it's not that comprehensive, or we just do want to focus on the weight for now. Or maybe you've done something like that with us in the past, and you still have a few pounds you want to knock out. So there's all these different ways that we can dive into this with you. So let me show you what our 3 different choices are. So we have what I call the Ferrari, if you want to call it, but peptide injections. You've heard about this before. I'm going to dig into these a little bit more, but this is somewhere between 4 to 6 months for some patients, even longer. I have some that have been on it a year now, depending on what your goals are and where your body is. What the beauty of this is that we do guide you through eating a healthier diet, and when you're feeling better, to start moving and exercising more, but it's not dependent on that. So really, we're seeing great results. This is really good for somebody who's just like, I can't think about it. I just want something that works. And I've been, for years, from my own personal experience, I have a lot of insulin resistance in my family. I've always been a carb counter since I was, high school, college age. And I've constantly had to think about it. And when I went through this program myself 50 pounds ago, it was really just a huge mental relief for me to not have to think about it so much anymore, because the weight just kind of started to come off naturally. I did eat less, and I've always focused on eating healthier foods, but I didn't have to think about it so hard. So that's really beneficial. It's going to take a little bit longer. We start with low doses and increase to minimize any negative effects. So weight loss may not happen for that first 2 to 3 months, but it definitely happens over time. And we see great benefits here. This is probably my favorite program for me personally, but also for what we get to see with our patients. Just today, I got a message. We had a patient who's lost 48 pounds in this program over the last 6 months, and she is absolutely thrilled, and it's just fantastic. This is weekly self injections into your stomach, so very small, like insulin injections. We guide you through everything. I'm going to talk to you about it in more detail here in a minute. The next available program that we have is called our Metabolic Reset. This is about a 10 to 12 week program where we take you through kind of a intermittent fasting along with a spray that we use to help reduce appetite and mobilize your metabolism and mobilize fat burning. So this is some dietary restrictions for sure. We want to get rid of carbs and excess fat. And we see great weight loss here. This is one where you're going to lose 20 pounds in a month. So if you've got an event coming up that you really need to lose something fast, this is a great opportunity for you. Or if you're terrified of needles and you don't want to do that, then this is a great option there as well. And then the third option is our detox. So I'm going to talk in detail about that. We have 30 and 60-day detoxes. So again, these are shorter. These are more designed for that 8 to 10 pounds where just still feeling some gut related stuff, that bloating. It's more about getting your body back on track and healing than it is weight loss, but we definitely see a good 10 to 15 pound weight loss for most patients in that first month. We have dietary eliminations. We're going to give you some supplements and shakes that go along with it. And we work and educate you towards eliminating toxins inside your body. And I'm going to talk a little bit more about why that's important and why that might be helpful for you. So let's dig in a little bit more to peptides. And peptides, you may have heard these out in the media. They're very popular right now with Ozempic or semaglutide, as well as tirzepatide. And we in our practice have done extensive research and worked with compounding pharmacies and companies and exclusively use tirzepatide in our practice because it is the one that is most effective with the least amount of side effects, and it is well worth it. We've seen too many negative things go on with semaglutide, depending on how it's dosed and treated, and it's just not worth it, in my opinion, if we have something available like this. So tirzepatide is a peptide. It works naturally to help improve your insulin resistance and decrease your appetite. And insulin resistance is probably the number one thing that I see in patients that are struggling with weight, because the more insulin you have, the more fat you store. The more fat you store, the more insulin you need, and it just becomes this vicious cycle. And you have highs and lows in your blood sugar, and you don't feel good, and it creates a lot of dysfunction. So when we combine this with, making some healthy dietary changes, we're going to see some fantastic results in that 2 to 3 month time frame. Again, these are administered weekly. You do these under your skin in your stomach. We start really low dose and we titrate up from there. And we see this absolutely in our practice, seeing one of the best results that we've seen. And I'm going to talk you through why this is better for you than doing something else. So you can go to a regular doctor or maybe another practice or a weight loss clinic somewhere, and these regular prescriptions that are out there, that they're pharmaceuticals that you get a prescription for and you go to the pharmacy, most insurances are not paying for this unless you are a documented type 2 diabetic. And even then, I'm seeing a lot of hard times getting these covered, especially the tirzepatide, because it's newer. It's better. It's far more advanced than the other ones that we've seen. So they can be really expensive. I've seen quotes up to $1,500 or more a month for these. And what's frustrating with my experience is that these come in pens and they're injected. There's one dose and you cannot adjust it. So if you're having any kind of side effects, or we need to slow down, or you're concerned, or we want to speed up a little bit, either way, it's very inconsistent for us to be able to change. It's very inconsiderate for that reason, and it's not flexible. So that's really difficult. And then generally, because of that, doses are too high, and we're seeing a lot more nausea and vomiting. And I even had a patient that was sharing a story about her friend who lost like 80 pounds in a year, but she threw up every day. But that's, what her doctor thought was normal. So, that's not the way to go. We want to make sure that we're taking care of you specifically and what your needs are. So in our program, we guide you. It's much more cost effective. It's still a significant investment, but again, one of the best investments I've ever experienced with my health and my weight. So it's way cheaper than $1,500 to $2,000 a month. We spread it out over time. So it's definitely more cost effective this way. We individualize it. You're going to have coaching weekly with our staff. We're going to make sure that you're on the right dose, that it's working well for you, that we need to make adjustments. Are you staying hydrated? Are you eating the right amount of protein? Do you need any extra supplementation? We do B12 injections with that. So much more support than what you're getting through a typical clinic. So that's why our results are so much better than what patients may see in another practice. Again, I want to mention the metabolic reset, about a 10 to 12 week program. You're going to see rapid weight loss here. I mean, we generally will see 1 pound a day, sometimes more in the first 3 to 4 weeks. So you're going to combine some intermittent fasting with a structured, organized meal plan where we help guide you through exactly what to eat. So this is really beneficial, and we're going to see great results with this as well. Again, you're not going to have to inject yourself with any needles. We do weekly coaching sessions with this. You're going to have orientation with one of our health coaches. We include Super B injections to help support that weight loss and fat metabolism. And we give you a detailed guide, including recipes and a journal. Again, no injections with this metabolic reset. That may be a great choice for you. And then detox. I really want to make sure you understand why this is a good option. So when we are exposed to toxins in our environment, whether it's something that you're eating, you're breathing, the water that we're drinking, is it purposeful or is it accidental or involuntarily? There's so many different ways that toxins come into our body these days. And our liver's job is to help protect us. Our whole body's job is to help protect us. But as our liver starts to metabolize and to filter through these toxins that we're exposed to, if that liver starts to get sludgy and it slows down, let's think about the lint catcher in your dryer. So if you're doing load after load after load of laundry and you never change out that filter, then what's going to happen? Your filter is going to slow the dryer down. So you're going to hear the buzzer, you're going to feel the heat when you open the door, but the clothes are still going to be wet. And our filter is not functioning the best, and it makes our dryer less efficient, and you have to run through cycles again. And the same thing happens in our body. If your filter is sludgy and your filter is overworked and overtasked, then your liver's not going to be able to get through those toxins the way that it should, and it slows everything down, which means that we store more fat. The other thing that happens is that our body's job is to protect us, and toxins are bad. And if it can't get rid of those toxins efficiently, then it's going to create storage units. And the best storage unit for fat, for toxins, is fat. So if you've heard of fatty liver disease, that's what we're seeing more and more of, is non-alcoholic fatty liver disease. So it's not alcohol that's creating this dysfunction, but it's the toxins that we're exposed to, medications, food that we're eating, again, things that we're experiencing in our environment. And our body is trying to protect us, so it stores that in fat. And the last thing it's going to do is get rid of that fat, because it doesn't want you to be damaged or have any danger by those toxins being in your body. So when we take somebody through a detox, it clears all that out. There is a conscious change in your food with some eliminations and things like that. So we do see some weight loss from that, but a lot of that is coming through releasing some of that inflammation, releasing those toxins from storage out of your body, and allowing your body to do what it does naturally. So depending on where you are and what you've done maybe with us before, we have 30 or 60-day programs. Some of them come with laboratory evaluation, particularly guiding you through a dietary antigen test, which tells you what foods to eat and what foods not to eat based on your body's reactivity. We're going to help guide you through healthy liver cleansing. This is not colonoscopy clean out. It's very easy to do, but we want to make sure that you're doing it correctly so we minimize any side effects and it's effective. We'll tend to see somewhere between, again, 15 to 20 pound weight loss if you do the 60-day detox, 30 pounds, a 30-day detox, more like 8 to 10 pounds. So depending on, again, what your goals are, what you're looking for. This also helps you, especially if you do the 60-day. We're going to eliminate and then reintroduce and be more conscious of your nutrition habits. And then, of course, guide you through some movement so that we're getting rid of those toxins by sweating or lymphatic drainage as well. So that's what we do for our detox programs. And you can combine those two together. So maybe you want to do a detox, 30-day detox along with a peptide injection. That would absolutely work fantastically together, because not only are you getting through to that insulin resistance and decreasing your appetite a little bit, but then you're going through the cleanse and cleaning your liver as well. So those are some fantastic mixes together, or a metabolic reset with a detox also can go together. So again, it's important for us to meet with you and understand, where you are in your area of need so that we can get the best results for you. What are we seeing? I mean, obesity is the #1 most preventable disease in the US, and it leads to all kinds of stuff with high blood pressure, high cholesterol, diabetes, cancers, increased risk for everything. And it's so easy to now have these tools in place to help you get in control of your health and get control of your weight. You're looking for doing something quick and easy, although easy, I wouldn't say, with tummy tuck, liposuction, lap band, gastric bypass, all that kind of stuff. I mean, not only are they expensive, but their failure rate is so high. And we're really, again, not helping the body to know what to do and how to treat it correctly. So we're always looking for root cause and healing and recovering so that the body can do what it's supposed to do naturally. Thinking about Weight Watchers, Noom, all these different things out there, we're seeing not great customer satisfaction and significantly high failure rates after 1 year. So really, it is not just about having that accountability, although we know that that's important, having a structure in place, but really figuring out what is the metabolic issue with your body and how we can help you. So hopefully this answers some of your questions. Where do you go from here? Well, we do a free discovery call. So you'll meet with one of our providers on the phone or in person, whatever your preference is, and we'll talk you through it. We'll review these choices again, kind of get a little medical history from you, and then we'll move forward in getting you started on your best path to your new you and a better way, a better health. You can call our office at 864-722-9262, sorry, 864-722-9262 to schedule that call, or you can go to our website at Carolina Integrative Medicine and request an appointment right there. I hope you have a fantastic rest of your day, rest of your week, rest of your year, and rest of your life. And we look forward to seeing you in our office to help you find the best way to optimize your weight and your health. Talk soon.